Osteoporosis means porous bone, and this weakened bone could be at great risk of fracturing. May is Osteoporosis Awareness Month, so we spoke with Dr. Douglas Kiel, who is the director of the Musculoskeletal Research Center and senior scientist at the Marcus Institute for Aging Research in collaboration with the Hebrew Senior Life.
Osteoporosis is usually associated with getting older. However, prevention starts much earlier in life.
As you grow, the skeleton accumulates more and more mineral, and it builds up to its maximum amount of mineral at about the ripe old age of 25 or 30, which really makes people stand back, and they're very surprised to hear this. But we often think of this growth of the skeleton as a bank account. So during the younger years of life, what your goal is to maximize your bank account savings.
Some steps you can take to build strong bones are having a healthy diet, exercising regularly, not smoking, or not consuming an excessive amount of alcohol.
As you grow older, you begin to spend down your bank accounts. So osteoporosis develops in life later on if you spend more bone in late life. So what are the factors that make you lose bone with aging? Well, in women, one of the major events is the menopause, because when you stop making the female hormone estrogen, the bone reacts by losing its mineral in a rather rapid fashion compared to the other parts of your life. It ultimately levels out a bit, but after the menopause in women, it does tend to be lost. In men, it creeps down slowly.
You can find out about your risk for osteoporosis with a bone density scan.
The bone density test is a very easy test that's paid for by insurance. Even for our older adults, Medicare covers this test. It takes about 3 to 5 minutes to complete, and it can give you a number, like when you go to the doctor and you get your cholesterol measured or your blood pressure. The doctor says, oh, your cholesterol's up. That means you have high cholesterol. And in the bone density test, you get your density, and the doctor would say, your density is low, your bones could be weak. And people with high cholesterol, they don't necessarily have the condition of heart disease right then, but they might be getting it. And if you have a low bone density and then you fall, for example, you might get a fracture. So it's very important to know your bone density, and since insurance covers it, you can get it when you're 65 from Medicare, and most women can have it covered by their insurance after the menopause because of that period of bone loss that occurs.
Why is it important to be aware of your risk of osteoporosis?
The fracture can actually cause a substantial amount of pain and disability. Just to give you an example, if you break your hip, it's quite painful. You have to have major surgery. You can't walk after the surgery, and you have to go to physical therapy for weeks and weeks and weeks. And you may still not be able to walk without a walker. You may not be able to take care of yourself because you can't get around, and you may have to go into a nursing home. And so it's quite a serious fracture. And we know that if you have one fracture, your chance of getting another fracture is very high. So it can kill you. A fracture can be serious enough that, you don't survive the surgery if you have to get it fixed in the operating room.
If you do have osteoporosis, then you may want to talk to your doctor about medication for treatment and look into fall prevention. If you would like more information on this disease, you can go to the Bone Health and Osteoporosis Foundation's website. For the Needham Channel News, I'm Ashley Morin.